I'm gonna make a video. It's a little different than what I usually do. Usually I'm trying to make a video of working on my side by side my tractor, a project I'm doing, or just flat out beating around thumping in my shop, or talking about different types of products. Well, I'm gonna make a video about something I've had to go through that a lot of men and women have to go through, and it's carpal tunnel surgery. By no means did I ever think that I would have a surgery that I always thought that it was associated with typing or just something that I don't do a lot of. Well, come to find out, this is about repetitive motion. You know, you're always wrenching. We're always working with our hands. Carpenter, hammering nails in. These are all jobs I've done my whole life. And I've worked with my hands a lot. So about a year and a half to 2 years ago, I started experiencing a little bit of numbness in my hands, especially my left. And you shake it, it'd go away. You go to sleep and lay it on your chest above your head or something, it'd be asleep, wake it up, drop it to your side, be all right. Well, working above your head got pretty tough because, like I said, especially on both my hands, but my left especially, it would start hurting a little bit. Well, over the last 5-6 months, like I said, the pain has really intensified. You'd be working with it above your head. I would wake up 2-3 times a night and have to take a leave, Tylenol, just whatever I could take to get the pain to go away. Well, the last month or two, it got to the point I was really having to look at this. My local physician helped me start pinpointing people now, and of course, I was looking back towards where I'd had knee surgery at, and I've had a couple of different doctors now, orthopedists. I'd had Dr. Hovey many years ago, Dr. McGarry, out of the Bristol area. And, I was actually looking back that way. And anybody that I had actually looked at back that way and in a couple of different areas, it's a 5-6 week procedure. In other words, you're down for 5 or 6 weeks healing after the surgery. And in this blue collar world that I work in, most employers do not like us out of work for 5 or 6 weeks over something like this unless it's an absolute gotta have it. They just don't like it. Me and my wife got on the internet. We started doing some research in the last, like I said, month or two. We found that they could do an orthoscopic type procedure. It cut it down to where it's about a week and a half, 2 weeks. Healing process, put you back in the workforce. I'm like everybody else. You got to have an income. And 5-6 weeks, that's just more than I could stand. 2 weeks is manageable. Turn in a bunch of vacation time, and there you go. Well, I'd kind of conceded that's what it was going to be because it was really hurting. So my wife gets on the internet and she says, I found another procedure. Instead of it doing orthoscopically, it's done with an ultrasound machine. That interests me. And I said, okay, what are they, what's the recovery time? They started saying that, she said this thing reads 3 to 5 days. That was just unreal to me when we first looked at this. So we looked into it. We found a place, I think she said it was up in South Boston, Lexington, Kentucky. And there was a place out in California or something, and that's just about all we could find. Now, you might get on the internet, Google it, whatever, and find some different places that does this procedure. That's what we found. The one in Lexington, Kentucky is the closest to me living in Virginia. Well, long story short, we pick up the phone. We call a facility called Bluegrass Orthopedics. Get in touch with a doctor named Dr. Victor Marwin, Marwin. I hope I'm pronouncing that right. I think I am. Well, anyway, we set up our consultation visit. I went. I cannot talk enough about Blue Ridge Orthopedics and the staff. I cannot talk enough about him especially. Sat me down, told me exactly what this was. His staff did too. A little bit of it, I didn't understand everything about it. He told me the reason I was hurting so bad at night was when your heartbeat slows down, because you're at rest, it's not pumping as hard. The canal in your wrist is one size, and the vein, or not the vein, but the nerve is swelled. So your hand is starving for blood. And after I thought about it, I understood it. Because when you get up and you start shaking and moving, getting your heart rate up, it's pumping harder, it's pushing more blood through. That made a lot of sense to me. So I agreed for the surgery. My time frame right now, I'm making the video, I'm about 36 hours past surgery, post-surgery. I can tell you this. I woke up this morning, which would have been a little less than 24 hours, I would imagine, maybe a little over. I wasn't hurting. I didn't hurt last night. Now I'm tender. I'm sore. But I'm not hurting. Now, I'll tell you this, the most painful part of this whole procedure so far is I took 3 shots in pre-op. 2 of them, they didn't hurt me. They were right in my wrist, just little sticks. Did not bother me. I took one in the palm. I can tell anybody's going to have this. And I'm going to tell you the one in the palm, it'll get you attention and get it in a hurry. That hadn't hurt. Now, I've got asthma. So, I've had the old artery punch measure that O2 level, and I promise you, it compares to that. It's a pretty tough little stick. Okay, so I take it. They take me back to the surgical room, and my anxiety level is a little high because I'm getting ready to have surgery on my hand, and I'm awake, and I was not knowing exactly what to expect. Once again, Georgetown Community Hospital is where I'm having surgery at. I cannot talk enough about this place. It was clean, very hospitable. The people were nice. They helped us in any way you wanted. The nurses in the pre-op, great. The nurse post-op, great. Talk to me. During the surgery, there's 2 individuals in the surgical room. There's Dr. Marilyn. Just to keep me calm, they're all talking to me. We're exchanging where we've went to school, what we've studied. And of course, it always leads back to my deer hunting, my fishing, my beating around side by side in tractors. And everybody has a common interest in some of that stuff. They offered to let me watch the screen. I kind of passed on that one. But, you know, leading up to this, Dr. Marilyn had told me he had done north of 800 procedures, which I thought was a lot, but apparently it's not. So I know this is a pretty new, what you'd call a pretty new procedure. But let me assure you, it went very smooth. They took care of me. I felt as safe. I never felt no pain. They renumb me in there. Just, you know, they're doing their job. Post-op to surgery, back to pre, 45 minutes. That would be a long time. And I was done. Now, like I said, I'm about 36 hours post-surgery. Last night I got home. I started trying to bend my hand. I'm going to show my hand. I'm not going to show it unbandaged because I'm still bandaged from it, and I am going to wear them tomorrow. But last night, I could do about my index finger and my middle finger. And I felt it was pretty good because they give you a sheet to start doing your therapy. Well, I started because any knee surgery I've ever had, they get you right up. Now, even this morning, I was doing better. I've got index finger, middle finger, ring finger. I go, bam, well, right there it is. I got it. Pinky finger. You turn it sideways, and they got some hand stretching. You fist, thumb open, up, left, reel it in, and I go back. I've done this all day, probably more than I should. I'm a little tender, a little sore. No pain. No Tylenol, no Motrin, no nothing. So all I can say is if anybody is thinking of a new way to get carpal tunnel surgery that's definitely less painful, less time consuming. Go see Bluegrass Orthopedics, Lexington, Kentucky. Please get up with Mr. Maryland. This gentleman is top tier. That's the nicest, easiest, best way I can describe this gentleman. He's top tier. I mean, he is. He's the top of it in my book. I hope this video helps somebody make a decision on what they're going to do. I hope it helps somebody.